Have you heard about GLP-1 medications like Ozempic, Wegovy, Mounjaro, Zepbound, and semaglutide? These medicines are everywhere right now. People are searching for GLP-1 weight loss, Ozempic for diabetes, Wegovy for obesity, Mounjaro results, and GLP-1 side effects. But the big question is, how do GLP-1 medications actually work inside your body? Do they really help with weight loss? Are they safe? And who should never take them without medical advice? Today, we will explain everything in simple words. First, let's understand what GLP-1 means. GLP-1 stands for glucagon-like peptide 1. It is a natural hormone in your body. After you eat food, your body releases GLP-1 to help control blood sugar, insulin, digestion, and appetite. GLP-1 medications copy this natural hormone. That is why they are called GLP-1 receptor agonists. In simple words, these medicines tell your body, slow down digestion, control hunger, release insulin when needed, and keep blood sugar stable. That is why GLP-1 drugs became popular for type 2 diabetes treatment and later for medical weight loss. Now, let's talk about how they work. When a person eats food, sugar enters the blood. In people with type 2 diabetes, blood sugar can stay too high because insulin does not work properly. GLP-1 medications help the pancreas release more insulin when blood sugar is high. They also reduce a hormone called glucagon, which normally tells the liver to release sugar into the blood. This helps lower high blood sugar levels. But that's not all. GLP-1 medicines also slow down how fast food leaves the stomach. This is called delayed gastric emptying. Because food stays longer in the stomach, a person feels full for a longer time. Hunger becomes lower. Cravings become easier to control. This is one reason many people lose weight with GLP-1 medications. That is why searches like GLP-1 appetite control, GLP-1 weight loss injection, semaglutide weight loss, and tirzepatide weight loss are becoming so popular. But here is something important. GLP-1 medications are not magic injections. They work best when combined with a proper diet, enough protein, daily movement, and medical monitoring. If someone takes GLP-1 but eats very little protein and does no exercise, they may lose fat, but they can also lose muscle. That is why doctors often recommend strength training and healthy nutrition during weight loss treatment. Now let's talk about common GLP-1 medicine names. Some popular names are Ozempic, Wegovy, Rybelsus, Trulicity, Victoza, and Saxenda. Semaglutide is the active ingredient in Ozempic and Wegovy. Liraglutide is used in Victoza and Saxenda. Tirzepatide, found in Mounjaro and Zepbound, works on GLP-1 and another hormone pathway called GIP, so it is often discussed with GLP-1 weight loss medications. Many people confuse these names, but the purpose can be different. For example, some medicines are mainly approved for type 2 diabetes, while others are approved for chronic weight management in people who meet medical criteria. So never start these medicines just because someone on social media lost weight. Now let's talk about benefits. The first major benefit is blood sugar control. For people with type 2 diabetes, GLP-1 medications can help reduce blood sugar spikes, improve insulin response, and support better diabetes management. The second benefit is weight loss. Because these medicines reduce appetite and slow digestion, many people eat less naturally. This can lead to weight loss over time. The third benefit is better eating control. Many patients say they feel less food noise, fewer cravings, and less urge to overeat. This is why GLP-1 medications are now heavily discussed in obesity treatment. The fourth possible benefit is heart health for some patients. Some GLP-1 medicines are used to reduce cardiovascular risk in certain people with type 2 diabetes and heart disease risk, but this depends on the specific medicine and the patient's medical condition. Now let's discuss the important part, side effects. The most common GLP-1 side effects are nausea, vomiting, diarrhea, constipation, stomach pain, bloating, burping, acid reflux, and loss of appetite. Some people feel tired, weak, or dehydrated, especially if they are not eating and drinking properly. Usually, side effects are stronger when the dose is increased too fast. That is why doctors normally start with a low dose and slowly increase it. But some side effects can be serious. Severe vomiting, severe stomach pain, signs of dehydration, allergic reaction, low blood sugar symptoms, or pain that spreads to the back should not be ignored. People with a history of pancreatitis, certain thyroid cancers, severe stomach problems, pregnancy, breastfeeding, kidney problems, or people taking insulin or diabetes medicines must be extra careful and must speak to a doctor first. Now, here is a very important warning. Do not buy cheap GLP-1 injections from unknown websites, social media pages, or unverified sellers. Unapproved or compounded weight loss injections can be risky because the dose, quality, and ingredients may not be reliable. This can lead to overdose, severe side effects, or dangerous reactions. If you are using GLP-1 medicine, use it only under a qualified doctor's supervision. Now let's answer a common question. Will the weight come back after stopping GLP-1? For many people, weight can return if old eating habits come back. GLP-1 helps control appetite, but long-term success depends on lifestyle. That means protein-rich meals, fiber, walking, strength training, sleep, and regular follow-up are very important. Think of GLP-1 as a medical tool, not a shortcut. It can help the body control hunger and blood sugar, but it cannot replace healthy habits. So, who may benefit from GLP-1 medications? People with type 2 diabetes, people with obesity, and some people who are overweight with health risks may be considered. But the final decision should always be made by a healthcare professional. And who should avoid using it casually? Anyone who only wants quick cosmetic weight loss, anyone buying injections without prescription, anyone with serious medical history, and anyone who has not discussed risks with a doctor. So here's the simple summary. GLP-1 medications like Ozempic, Wegovy, Mounjaro, Zepbound, and semaglutide are powerful medicines. They can help with blood sugar control, appetite control, and weight loss. But they also have side effects and risks. They should never be used blindly, never be bought from unknown sources, and never be taken without proper medical guidance. Before starting any GLP-1 medication, talk to your doctor, check your health condition, understand the side effects, and make a safe plan. Because real health is not just about losing weight fast. Real health is about losing weight safely, protecting muscle, controlling blood sugar, and building habits that last. Thanks for watching us. Like, subscribe, and share our video to see more interesting health videos.